Hello, my name is Tessa, and here's my case report poster over my level one case study. This involves a 19-year-old male high school football player who was on the varsity football team who was performing barrel rolls after practice when he felt an immediate pop in his right knee, as well as a buckle, and he was unable to extend his knee fully. He was confirmed with a bucket handle tear of the meniscus. Just some background, the meniscus is a semicircle shaped piece of fibrocartilage that sits in the tibiofemoral joint. It helps to increase surface area as well as act like a shock absorber, as well as some other functions. It's most commonly injured with a rotational force when the knee is in a flexed position. A bucket handle tear is when the meniscus is torn and then flips over on itself, and patients normally present with being unable to fully extend their knee, just as my patient was. Some interventions for this patient were early quad strengthening and range of motion exercises because they didn't want him to have to play catch up after his surgery. His knee was immobilized by a brace for up to 4 to 6 weeks, and the physicians performed an inside out method, which means that they went in, basically cleaned everything up, put sutures in where it needed to be, and closed him up. Some outcomes for this patient were that he was given 9 to 12 months return to play just because he's had a previous knee injury on that same knee and in that same part of the meniscus. So it was going to take a little bit longer. He was able to return for his spring football season. He was not able to fully participate, but he can still do some of the workouts with his teammates. And he is given a 5 to 6 month recovery for the meniscal tear alone because they went in with sutures. Some conclusions for this were that range of motion and non-weight bearing exercises are very important post-surgery because you don't want to have to play catch up in your range of motion. So you just want it to be as good as it can be after, and then non-weight bearing because you don't want to pop any sutures. He was non-weight bearing for the first 8 weeks after surgery. Range of motion should be back to normal before he's cleared for weight bearing, again, because it's super important to have that range of motion already in place. And that should be your main focus at the beginning of your rehab. Some clinical bottom lines were that bucket handle tears are extremely painful for the patient involved just because they might not be able to move their knee. It is important for the patient to be examined by a physician just so you know what's going on inside the knee. And if the patient is lucky enough to have an athletic trainer, they should be involved in the entire rehab process. Maintaining range of motion is super important pre and post surgery, and the athlete should be mentally prepared to return to play just because they've had an injury. So it's important for them to have the right mindset going back in. And here are my resources. Thank you so much.